welcome, ladies and gentlemen. On behalf of the organizing committee, on behalf of SAP, CCL, and Siemens, and all other partners, I welcome you to this groundbreaking and future-making summit about patient experience. We've all, I'm not very good apparently with technology. So we've all had a very intense last 3 years because of the COVID-19. Yes, thank you very much. We all had a very intense last 3 years because of the COVID-19, which ran havoc across the globe. And that reminds us the immense and extremely heroic work that our healthcare workers have done, the doctors, the nurses, the paramedical staffs, the pharmacists. So I'll take this moment and request all of you to applaud for all those heroes who selflessly have, in the last 3 years, sacrificed themselves, their families, and their comfort for the betterment of the humanity at large. So I'll request you to join me a big round of applause to all our healthcare heroes. And a lot of them are sitting here among us. So we salute you, sir, and for your contribution to all of us. Now, when we talk about COVID-19 or a pandemic of that scale and nature, it went all across the globe. Nobody was fair, or even the so-called developed countries and the superpowers, we all have seen buckling under the immense pressure of this pandemic like nothing before. Now, what to talk about countries or developing countries like Pakistan, which even before the onset of this COVID, did not have a very strong healthcare infrastructure. When this COVID hit across the globe and it affected all of our lives, we understood the true meaning of an age-old phrase which says that health is the real wealth. And we all came face to face with that reality. So once there, what about countries like Pakistan, which were, even before the onset of the COVID, did not have a very strong health infrastructure? I'll share with you some statistics about our country, which will give into or bring to a stark or open up a stark reality of the developing countries like Pakistan. So in Pakistan, in terms of the healthcare infrastructure and facilities, we have 0.82 physicians or doctors per 1,000 populations. We have 0.57 nursing plus midwife staff put together per 1,000 population. We have 0.63 hospital beds per 1,000 population, and about community health worker, because yesterday there was a question about prevention. We only have 0.06 community health worker per 1,000 population. And this data for certain other pharmaceutical or allied professions like pharmacists is even more starking. We have only 0.9 pharmacists per 10,000 population. Now, when we compare that, and you can see behind me, some of these statistics, so it's far below the global standards, but it is also far below, not far below, but it also below than most of our neighboring countries. Now, in addition to this, if you add a twist of rural-urban divide, so various surveys have indicated and research done in this context tells us that in cities, the concentration of just doctors or physicians is 3 times more as compared to the rural areas. Now, this is about health infrastructure. So what about the nation's response or the state's response towards that? So we usually gauge the state's response in terms of percentage of the budget per GDP. So total budget spent on healthcare as a percent of GDP. So just to give you an idea that in Pakistan, our percent spent as compared to GDP and comparable to the rest of our regional countries is far lower, not only from the global standards, but just to give you a sense check, even countries like Nepal and Sri Lanka spend more as percentage of their total GDP on health. Now, various studies, one of the studies, and this health surveys and indices are measured through a very organized effort which is called Health Accessibility Survey or Healthcare Centric Surveys. It has two components. That index has two components. One of them is health services and other is the financial impact of it. And it is gauged through a universal health care, UHS index. Now the WHO's standard for, or the WHO's target for UHC globally by 2030 is 80 or 80 plus. That means that 80% of the population should have access to essential health services. In Pakistan, as we speak today, the ratio is 50, and even our target for 2030, the state's target or the government's target for 2030 is 65 plus. So even in 2030, we'll be far below than the global average in terms of the targets that we achieved and also in the regional average. Now this has been complicated. So the figures I'm sharing with you was even before the advent of COVID. So COVID has resulted in an additional burden on a developing country like us. As per the statistics available on public domain, the government has diverted resources from other healthcare initiatives to the tune of 1.6 billion US dollars to invest in procurement of vaccines as well as enhancing the overall diagnostic services of the country. And as per KPMG, just to get out of this situation we are all in, an additional 8 billion US dollar will be required for Pakistan. So that means a lot of that budget or resources which would have gone towards the normal healthcare initiatives would be diverted toward getting the country out of this situation that we were facing in the last 3 years. The government is doing something to create or provide the citizens with essential healthcare services. We have Sehat Sahulat program initiatives in some part of the countries, but the effectiveness and efficiency of that program, because it's just been launched, is yet to be seen. Now we face all these challenges in the healthcare space, and that's the spot where the technology can help us. Technology can help not only in terms of research endeavors, etc., that they're doing across the globes, or in terms of AI in advanced societies, and we've seen that. But in countries like Pakistan, very simple thing as a patient's access to a qualified doctors, in terms of patient's enablement of his basic right of understanding his health needs and be a partner in their own healthcare solutions or in their own disease solutions, in provision of information to them, access and a right to have their own records and understands their conditions and various touch points of the healthcare and accessibility to that. So this is the whole purpose of this summit today, to understand how technology, looking at the challenges of healthcare and our country at large, how can technology be an integrator? How can technology help the patients, healthcare providers, and all various touch points in the healthcare sphere? So we are very confident as supporters of this summit that the discussions which will happen today, the panels which will come over here, will bring in some solutions which we can club together in the form of a white paper. And these white papers will be, and this white paper will be presented to the authorities, to the policymakers. But above that, this white paper will be accessible to each one of us, because we also make those decisions on daily basis in our boardrooms, in our hospitals, in our technology companies. So those things, if come together, we, as all of us sitting here, and I am also very confident that it will bring in actionable solutions for most of us to contribute. We also need to understand that this one summit or one white paper is not enough, because as I was remembering a quote from Nelson Henderson, that the true meaning of life is to plant a tree under whose shade you do not expect to sit. As a pharmaceutical, as part of the pharmaceutical industry, and having a vast experience of working with our regulators, we do understand that it's a very evolutionary and time-taking process. But this is one step towards that direction. And I'm sure that all of us, when we put our minds together, will come up with some actionable solutions by the end of the day, which will make the life of our patients easier, and we will contribute in healthier and happier societies. So once again, I am looking forward to a very wonderful event and a very wonderful groundbreaking initiatives today and thoughts today. And I leave you with once again looking at what we've experienced in the last 3 years, so that we generally as a nation, we have short memories. So just on the closing, I will request a small video which will give tribute and remind us what these 3 years have been, and all the heroes who've contributed in this, in making sure that most of us survive this pandemic, and all of us are sitting here, and most of us are not wearing masks. So I think this is because of the heroic efforts of our healthcare providers. Thank you very much.